talk about familial cancer, we do refer to those cancer patients who report a family history of other cancers that are suspected to be related with their germline susceptibility. BRCA 1 and 2 were cloned 20 years ago, and at that time we used BRCA testing for family risk assessment. We wanted to know if women with a family history of breast cancer had a germline susceptibility, and how could we spare breast cancer in their relatives. Nowadays, this field has evolved tremendously, and BRCA testing may impact on the clinical management of the patient and his or her family members much farther than only risk assessment, and it may have impact on surgical decisions and also systemic therapy. Yes, if a person has a concern that he or she may carry a genetic susceptibility to breast cancer because of his or her family history, the most important thing is to get advice from her physician or his physician. They can advise and they can be referred to familial cancer units. In that unit, specialists will take in consideration the family history in order to find out if recommendation for genetic testing should be performed. The importance of identifying a BRCA gene mutation goes much beyond the risk of developing breast cancer. There are other cancers who might also be under BRCA genetic susceptibility. The second most important one is ovarian cancer in women. But then in male BRCA2 carriers may have an increased risk of male breast cancer and also prostate cancer. And in some cases, pancreatic cancer might also be a consequence of a germline susceptibility. Threshold for BRCA testing has changed depending on the clinical use of that result. When we frame it under a family risk assessment, the threshold tends to be higher. So you perform BRCA testing under a high probability of identifying a mutation, since you're finally going to impact on your family members who are healthy people. And a balance between benefits and prejudice of genetic testing are important in this setting. For women who have been diagnosed with ovarian or breast cancer and who may get a specific targeted therapy if a BRCA mutation is being identified, the threshold for genetic testing decreases, because that result is going to impact immediately on the medical management of that patient. That's why clinical guidelines for BRCA testing are nowadays being updated, depending on the clinical situation where they will be used.